Hi, so my name's Alice Hopritz. I'm one of the lecturers here at Coventry University, and I have a video today to introduce Farouk, who's going to talk to you about some of his experiences as a student. Do you want to introduce yourself?
Hello, I am Farouk Bello. I'm originally from Nigeria, and I'm doing physio on the Coventry University course. Finishing physio, actually.
You've finished.
Finished. I think that's the best word to use. Still very weird saying finished.
So you're going to tell us today about some of your experiences of clinical placement.
Yeah, so I think my personal experience of clinical placement has been both up and down. But I think a lot of sometimes when it's down, even when I'm having a good time on the placement, there are still things that I've had to be aware of that in a perfect world I shouldn't be thinking about so much. It's, a lot of it has to do with my race as me being a black guy is thinking things like, am I being asked this question or am I being judged this way because I'm black and not just because I don't know the answer. In a perfect world, I think that if I said, what's it called? If I said, oh, they asked me a question or I was getting in an environment and I would just say, maybe I'm feeling this way because I just don't know the answer or I haven't learned enough. That would be a reasonable response. Not, am I getting this treatment because I'm black, or am I being compared to another student, which is one I think I felt quite a bit. Am I being compared to another student just because I'm black and she's white and we have different experiences and we have different things, but she's being held to a different standards than me. And I think that was one thing I've had to constantly think about constantly every time most of the time I'm on placements, and it's checking my attitudes to say, how do I behave out of placement and how do I behave when I'm on placement, and not from a professional standpoint, just from an attitude, my daily speaking, my daily mannerisms and things like that.
So is there anything in particular that you can think of any examples of when you've considered or you've had to ask yourself that question of, am I being treated differently?
I think a good one was one of the placements I was on. I had gone through the placement. It was already a hard placement, but I wanted to enjoy it because it was an area I really wanted to be in. So I was really actively trying, and a lot of the time I would get, even when I got questions, and I would get questions. Sometimes I wouldn't be able to answer them, or sometimes I may have not been a perfect student because I was still learning at the time. But I was asking questions and getting questions. I think a lot of it was at the halfway point, I was told that I was just about passing, which for me that was a very big shock because I'm coming off other placements where I've actually done very well. So this was like a very stark contrast for me, and I was told I was just passing. And at the end of the placement, I was told I was still at that same point, and I didn't really rise much. Even after I felt that I had seen, okay, I'm really falling behind, and I pushed myself. And I know sometimes, I think sometimes it's fair. Sometimes some people just don't get better, but a lot of the time I was starting to check myself. Is it because I'm race? And it wasn't me pulling out that race card. It was things that had happened on the placement, like I was getting comments. I would get input from what's it called, other members of staff. I think a few other members saying things about my attitude and saying, oh, uh the way he seems is he seems complacent, or he seems relaxed, or he seems, and to me in my head I think that is just the way I am. That is my natural demeanor. I'm normally a relaxed person. I don't get antsy, I don't panic, and I try and keep cool. My voice is naturally like this. So I started to ask myself, is this why they're saying that I'm complacent? Is it just because of my attitude? And I think that ties strongly to, I think, some level of racial biases, because a lot of the time if someone has never seen a black person, or you've only heard about black people, or you've heard about the general consensus of what you think, stereotyping, that's the word. I felt I was being stereotyped. The question is whether or not I really was, may not be as important as how I was feeling on that placement, because I feel that actually impacted my learning a lot. Because at some point I just said, "Ah, I'm so tired of this because it feels like you're fighting harder to get better, but just something, an invisible wall that you can't even control, is limiting you." Or I didn't feel like sometimes I was getting talked to, or I don't feel like it was even being addressed, talked to in a manner which I felt comfortable in. I felt I was being talked to in a different way from the other students, or getting support just because either it was uncomfortable to bring up the racial things, or it was just the person wasn't really equipped to deal with how, well, they don't haven't really had a maybe haven't had a black student before or anything like that. That's how I was really feeling. And overall, it's not a great feeling going to placement. And I can imagine if you have a job you don't like, if you go into where you're feeling like you're being prejudiced, or you have to be extra on alert because you have to fine tune everything you say and about how it will be delivered, so it doesn't come off as it come off in a way and, oh, this black student is saying this, or this black student is saying that. That was one I really did not like. I'll quickly mention another one where patient, most of the time it's a elderly patient. He said some made some comments towards me, made some comments about my race and me being black. And another one was I don't think he wasn't very comfortable being treated by me because I was black. And I could sense that, but the question was, I didn't know what to do with that information, because I just felt uncomfortable, and I had to take it up with me and swallow it, because I didn't feel like my educator or anybody really there could actually help me, because I don't think anybody would have gone through that experience. And that particular one really didn't sit nice with me. I had to just go and talk to it with a friend or something, or family, but it was that I didn't really feel like I get the immediate support.
Yeah, so I suppose for kind of both university staff and for clinical educators, it's thinking about how could we have made you comfortable to talk to us about it.
I think the first thing, if you want to really check yourself, is to know, what do you know about that person's culture? Because if you talk about what do you know about my culture, what do you know about someone who's from India, someone who's from different cultures, do you really understand why they like this? And it may not be what's it called, doing a deep background search into each specific thing. It's just understanding, because I think sometimes when we talk about history, some parts of history are intentionally left behind or cut out, like slavery, or people feel uncomfortable once you bring up something about race. And I think that's a level of willful ignorance when you choose not to acknowledge that these atrocities happened, but and you don't want to learn anything about it, and you don't want to know why, but you've just said you've based your assumptions of people off stereotypes, which is everyone, there's stereotypes in every culture, but when you really start impacting someone's life based off stereotypes, that's when it really becomes impactful. So what was the question again? Let me get back in touch.
No, I think that's a really important point to make, and I think you're right, particularly just having grown up in the education system in the UK, it's often taught from one perspective, and that's the perspective people have unless they look for more. So it's just thinking then about having had that experience. You said you didn't feel like you could talk to staff. What do you think we could do as educators and clinical educators to make you feel more comfortable? Because we might not be able to, unfortunately, stop that racism from patients, but it would be better if you'd felt comfortable enough to bring it up with your educators.
Yeah. So the there are few things. So one of the major ones is, I think really should be shown, is that if institutions placements actually show that they are fighting against racism, because a lot of time people talk about it and say, oh, we're Black Lives Matter, or they'll put up a slogan and say we're fighting against racism, but what are they actually doing? I think one thing you can actually do is, when you're giving placement packs or you're giving inductions, it's knowing, what do you do. I think it'll take a while to form up real structured things, but when you start looking towards them, things like in your placement pack, because you give the student things about what to do if there's a fire, if there's an abuse, if there's a fall, there's an incident, if something happens, but there's nothing to say, what do you do if you get racially abused? Which I think, if you having that section there, even just having that section, so you can, a student who's comes in the first year, because for second year, first placement, if they see that and they say, okay, so this place is actually saying they're fighting against racism, and they actually show that there are step-by-step programs, or there's something you can do, someone you can talk to. And sometimes it's very important to know, when you're putting those things in like the placement packs, or you're talking about it on placement induction, because we do have a lot of placement lectures or seminars. So when you're talking about them in seminars, saying that, yes, these are things that you may experience, and unfortunately, we may not be able to do anything for you experiencing that, but what we can do is make sure that after effects of it are addressed properly, and we're giving you the support, so you don't feel like, so a student doesn't come out of maybe a racial, someone calls them a word or something and is not comfortable with, it doesn't come out feeling like, I've suffered there and I have to carry on like I said nothing just happened. Because when you pile all that on the students, it really does take a toll, and you're getting all these type of things. It doesn't make anybody's experience any better. And a big one, after, if you showing that, is also, in if you, for example, if you put in a placement pack, is signposting. I think I talked about that one, is saying sometimes an educator or a placement supervisor may not be the best person to talk to. And if that person can acknowledge and say, okay, I understand what I can hear, I can listening to what you're saying, but I don't feel like I may be able to give you the support. And obviously, it's all on the individual basis and its complexity. Some people may react differently. Some people may shrug it off, but saying that if this happens, you can say these are people who may be able to help you better, like the societies that are geared towards specific things like cultural health club. They're doing those sort of things, and I know CSP is doing something about that as well, saying that okay, so who can you talk to that can actually provide you the best support, and what can we do to try and see if we can minimize those abuses? Because I know a lot of times some hospitals they have posters of we don't condone racial violences, some don't. So a lot of times patients don't even notice that. But if you're showing that and you're constantly showing that people who are racist or who have racial biases either one or two things, they will either check themselves or they'll go into hiding. Which honestly, personally, I don't really care if someone is racist. They go into hiding. It's like if there are cockroaches behind the walls, better you don't even know they're there. Like sometimes, because they go into hiding because that forces them, because those are not, we all know that those are not good ideals to be hiding behind. No one should be giving racial biases. Those are just a few things. Oh yeah, big one is what to do. I think all these are things, because I know there's always a systematic approaches. If you make there's a systematic approach for a lot of different things. If you make a systematic approach for what happens if you take a special type of abuse on placement, how do we deal with it, and how are we going to support that student with realistic goals? That's a very big thing educators, placements, supervisors can actually do to support students.
Yeah, I think that's really important for educators, particularly who've not had the experiences such as yours. And we've had honest conversations about the fact that there are not many people in the profession at the moment from different cultures and different backgrounds in general. So it might be that you haven't got an educator that's had an experience like yours, but if you're an educator, you can signpost towards people who have had those sort of experiences.
Exactly.
Having that kind of compassion and understanding, and knowing where, like you say, if there's a process for where to direct people for support, that's really helpful. And I know we spoke a little bit about what you feel the difference in terms of equity and equality is.
Yeah. So when we talk a lot about equality in physiotherapy or equality in general, and people say, "Oh yes, we want black people and people minorities just want to feel like they're treated on the same level as someone who's white," because a lot, I can tell you now, almost every black person, if you ask you, do you feel like you're treated the same way? And most people will tell you no, and they already feel disenfranchised in the sense that you're feeling like you have to work harder and you're having to do extra stuff just to get to the same place. And even some most of the time you won't get to the same place. I think there was a statistic that came out and it showed what's it called? The amount of, according to bands in London NHS hospitals, where you would see that the high positions, management band 8, A and C's, were dominated by white population, which are managerial positions. But however, the band fives were actually, surprisingly, it was also black students, but it was black people, but it wasn't. We were getting more of the band five roles as opposed to the managerial roles, and you feel like that's not equal. But then equity is what we're doing to give them that support. It may not be the same amount of support, but it's the same amount to get them to the same place in a sense. So when we're talking about empowering, so that's why I talk a lot about supporting the students to make sure that, and it may be giving them more support, because everyone, we know that everyone doesn't start on 0%. Some black people, some people of backgrounds feel like they're starting on minus 10, minus 15. It all varies personally. So getting them that support so they can get to the zero where everyone else is starting, so their white counterparts are starting, and then saying, okay, yeah, we're gonna give you the support. So everything else you do is not based on your race, is based on what you're actually able to do. And that, I think, to me, that's what I think a lot about equity is saying, okay, yeah, you're not on the same level, but we're going to give you that support to be able to get on the same level. That way you can really have a fighting chance and you don't feel like you're constantly climbing an uphill battle. Because I know I can speak differently, but if you talk to some, I think I won't speak for them too much, but talk to some home students, they feel like they weren't able to get some, as we said that before, get some placements beforehand, before even getting on the course. Or I've asked myself a lot of the time, why are there not many black students in physiotherapy? There are a lot of black students in other courses, like, so I know sports therapy, I don't know the dynamic, but it's why is physiotherapy seem to be only one demographic, and this is a medical course. It's the medical profession. And I realize it's because a lot of students, people are not getting equity even from before they enter the university. And when they get on the university, that equity needs to continue. So everything is, in a sense, at a level playing field for everyone and not people on dragging behind. That's how I see equality and equity.
Yeah, so what I'm hearing is it's not about saying we treat everyone the same. It's about giving people the support so that the playing field is level.
Exactly.
People need more support to get there for a variety of different reasons. One of them could be race. It's about that getting there rather than saying, oh, we'll just treat everyone the same. That doesn't actually achieve equity in the end.
Yeah, because if you look at it, I'll use an example. I don't know how extreme this example is, but someone is disabled. You're not going to say, well, we're not going to give you the same amount of support that you give someone else who isn't disabled. You would say you want them to feel like they could get to the same level playing field by giving them more support, as opposed to giving them, just say, well, give everyone the same thing, so don't no one should complain. And I think one big thing I'll quickly mention is, as a Black person, I don't want to be victimized. That's a big one. So victimization is not looking at a Black students and say, or Black or minority. I say Black law because I am Black, and I'll just talk mainly for myself. But some of the things I say can be applied on a wider scale, depending how you use it. But it's saying we're not victims in the sense that, or feel bad for us. It's a thing that we want. I believe I'm a powerful person in the sense I believe Black people are very powerful and we have those things. But it's not looking down on us to say, okay, now we understand all your history, so we want sympathy. We didn't, know a lot of people don't want sympathy. They just want a level playing field, and that's really it. We asked a lot of people, it's a level playing field. For a lot of years, people don't feel like they've had that level playing field, but that's how I think about it.
Yeah, I think that's a really nice message, actually. I'm glad you said that about it's not about sympathy, it's about where we go from here.
Truly.
Yeah. So is there anything actively you think that we could do to change in terms of, we've talked about maybe teaching cultural diversity from a university perspective?
Yeah. So teaching it in from a university perspective, this also goes for both educators and for the students at the same time, is from that first year, because we talk about treat a lot of different things. We talk about mental health, which are all good things. We talk, but for some reason we leave out or we minimalize to the mere point where I can't, off the top of my head, I can't remember if we had a diversity lecture, honestly, or something geared towards Black people. Maybe we did, but it's not just in my memory. From a first year perspective, so when people come into the course, they are reminded that in lectures, seminars, in the handbook, that would be a great one, because I know some people read the handbook. Everyone doesn't read handbook, but if you're seeing it in lectures and we're having specific segments, having talks with students who have more people in positions now who have experienced some of these things, they come and they address the crowd, they address the cohorts, so that even not only the black students and the minority students feel like, okay, this course is actually going to give me the support I need, as opposed to me going 3 years and not talking about race. Is also educating white students who, because it's real, I know I said this before, they've never seen black students before, or they don't have any experience of it. To an extent, some people can say that's a level of willful ignorance. Sometimes some people may say, well, they just didn't have an opportunity. They haven't seen it. They come from very different backgrounds because the course is predominantly white white people cohorts. But it's saying these are the things you may face on placement, even though you're not going to face it, so you can understand. And it's giving that educational material, things like putting in the reading list when you're advising students to read about this, read about mental health, read about empathy and all these type of things. Put in some educating yourself about white privilege and things like this, because if sometimes if you don't check your privilege, but if you're teaching the cohort from a young age, but by the time they get to third year and by the time they're going on placements, they're able to start thinking a lot more times when they are teaching, when they're treating patients. Because I think that's, for me, that's the biggest concern, is that if a white, I think if you ask, there are a lot of, I don't have them off the top of my head, but a lot of studies have shown that black patients or minority patients don't feel like they've been treated fairly. There was a stat that came out that there are a lot of biases that come into it, and if you can quash those with educational resources from the early onset, from first year, saying that, I think there was a funny one where they said, black people, we are more tolerant of pain. And it was another study that showed that we weren't getting black patients were not getting about, I don't remember, but less, let's just say less pain relief than any other patient, because there's an assumption that, or you're, but these are not based off science. Not a lot of them are based off science, because we know it's not just based off science. It's based off either stereotyping or racist ideologies and saying things like this. By addressing them from early onset makes a long way down to the, and what you can do is a white student who maybe wasn't, who was willfully ignorant or wasn't really sure about, didn't really know about slavery, because if it's not taught in high schools or universities, I don't think it's taught very well in schools, but we'll leave that for now. It's saying it can change their whole perspective and make them more empathic towards more cultural diversity and other races. I think that one is what we can start doing: handbooks, seminars, educational materials, uh, and reflections. Because I said we reflect a lot, and if you're an educator or and you have maybe a black student, is reflecting, are your cultural biases being checked? Because regardless, I know stereotyping is something you do it instinctively. Sometimes you don't even realize. I do it if I see a certain demographic. There's some things you've seen based off movies, based off pop culture, that you already think that's probably it. But then if you can then say, okay, no, am I making these decisions based off what I think or what the person is actually doing? That makes a whole huge difference. And if you can constantly check that self actively, because sometimes passively you might just forget all these things. That's one thing that looking at educators and placement and tutors can actually do, to say we're giving each student a fair chance in a sense.
So really reflecting upon unconscious bias.
Yes,
Yeah.
exactly.
So not just thinking, I don't do this, but thinking, am I doing this? And just taking a moment to think about that.
Yeah.
Yeah.
And
Okay.
one quick thing. A big one is not being uncomfortable to talk about. As an educator, as a student, as a placement, is not being uncomfortable to talk about race, because I think that's the biggest one that hinders any form of positive change. Because if every time a black student brings something about race, everyone gets uncomfortable and everyone gets quiet. I remember someone telling me that they were doing something regarding race, and they talked to some people, and as soon as they mentioned a black study, the whole room went quiet. No one had any input on that situation. Which in my head, I'm thinking that right there is a problem. Is making the whole environment. So if I'm in a group of we're four white people, and I start talking about this George Floyd killing was ridiculous, or there are loads of injustices even in the UK, is not for everyone to get quiet and just let me talk. It's to say, ask questions. That's a big one. Asking questions. Don't be uncomfortable to ask questions. I'll be honest, there are questions that, as I'll be like, I feel like you should know this. But the back of my head, I'll say, at least you're asking that question.
I think that's a really important point, to say, ask questions. Because I think, as a white person, I can talk from my experiences, but I can't experience what other people have experienced. And that's one of the big reasons I've asked you to speak today, is so that we can ask questions. And I think that's really important to say, ask questions.
It very much is, because it's often overlooked, and it makes people feel uncomfortable. And the more you ask those questions, and you start to understand. If you have a black friend or you know someone who's black, it may not necessarily mean, just if you're not if you don't talk to the person before, you don't know the person, just don't randomly just go and start asking, firing off with questions. But you can have a conversation. We can have a conversation about a lot of things. You can talk about mental health, empathy, diversity, and disabled, everything. But when you get to the cultural side, don't feel uncomfortable to ask some of those questions, by asking, how did you feel throughout the course, or how did you go, how does this make you feel, or why is it so, or why do you feel like you're disenfranchised, why do you feel like you feel less empowered? And then you maybe start to clear your mind and say, and then, because realistically, as I personally don't think that, uh I think everyone needs to be on the same page for change like this to really happen, for anything to be happening. Because if just only the people of BAME are making this case, it can only really go to an extent. But if you don't have everyone else on the same page making that fight as well, and saying we're standing against racism and every other thing that comes under it, because racism is just one thing. There's loads of other things, as we said, biases, uh rude, bad remarks, or in on there's also passive and active racism and things like that. Are you checking yourself to make sure that we're fighting against this with the community?
Yeah. So the one other thing that I wanted to ask you about was just how you think we can widen access into the profession for BAME students.
Yeah, so this one is actually this one is a more of a long term thing, because if you looking into the recruitment process is a big one. How are universities recruiting physiotherapists? Because if you notice, the influx of patients we're in, I think in my cohort is four black students, and the one above is, well, I don't know, one or two. The one below is less. It's always less than. It's not.
And that's out of more than 100, we should say.
Yeah, just so you know,
Perspective.
less than, if it's more than 100, it's less than 4%, which which is really, it really does say a lot. So looking at that recruitment process, where is physiotherapy being marketed? Is it only being marketed to one demographic? Because a lot of things I've heard is, I try and listen to people, other black people, which as a black person, I'm listening to other black people to see what are their experiences, and they feel like they didn't know about physiotherapy at all. I know a lot of black parents, if you're not in healthcare, you're not going to know about physiotherapy or anything like that, because it's mostly sometimes word of mouth. And then some people on the course, they'll say, oh, my mom was in physiotherapy, or I had a family member. Or the only time people actually see physiotherapy is when they need physiotherapy as a patient. And then you'll be like, oh, what's this profession? Or you mix physiotherapy with sports therapy, because you see on Chelsea on the club, you see someone run out, you'd be like, oh, that's the sports therapist. No, that's the physiotherapist. It's recruitment process is, are you marketing it to just one demographic? And I don't, obviously, I'm not in the recruitment, I don't have hardcore stats, but I think these are questions you need to ask. And for those who are actually in those room making those decisions and saying, okay, what schools are we going into? I don't know, what schools are we going into? Who are we inviting for the open day? Because I've worked open day for physiotherapy. I worked a few open days for physiotherapy, and it's the same set of people I see. I've worked a few, and it's the same. A lot of white students, and I remember one clearly, and I talked to her, and he said, "Oh, why are you doing?" I said, "Oh, my mom is a physiotherapist, and she's also a white lady, so her daughter's gonna do it." And I think that's the case for a good portion of the students. Other ones is either they just know, it's very broad send, because I think in some communities, when you talk about physiotherapy, when you talk about healthcare, it's only doctors and nurses you think about. That's the first thing. The doctor and nurses. So I know in nurses they have a way more diverse community than physiotherapy by far. I think for nurses, and it's looking into why is it that physiotherapy doesn't.
Yeah,
I'll
maybe we need to do more about. I think I hear the same thing when I hear people talk about healthcare, and the NHS is in the news a lot now. It is often doctors and nurses, so it's promoting physiotherapy in general wider, but also actively promoting widening diversity in who we get into the profession.
Yeah,
Like referring back to that idea about equity, bringing that level playing field up, rather than just saying, oh, it's the same, anyone can come. Actually saying, how do we bring more people from more?
exactly. Actively saying things like, I don't know, doing campaigns into communities where they have more minorities, more people from more black students, more BAME background students, is actually going into those communities. The same, basically, almost the same way you would go into the white community and say, go to a white school and say, I don't know if they do open days or open day things where they come in and hand out. Oh yeah, they did that. That's how I even found out. That's one of the reasons back when I was in Nigeria is I think Coventry University came and then they marketed it a bit. But doing those same similar things here and go actively having campaign programs where you're saying we want more people from this background, because 4%. And I remember there was a picture that came out from another university where they had no black students at all. In the whole cohort, they had not one single person. And those are all the people who are going to be pushed into the healthcare system as physiotherapists. And I think if some people don't really know about physiotherapy, but I assume people who are listening do know physiotherapy. We do know that physiotherapy is very crucial in a patient's treatment, the rehab. Doctors and nurses will give you so much, but your quality of life can be significantly changed by physiotherapy. And if you're not able to give that patient, because you don't know why about anything about their culture or cultural differences, you're going to be limiting yourself very much and limiting that person's goals.
Yeah, I think that's a really nice message, that we want to make the change within the profession, but it's important to make that change for the patients because our patients are everyone.
Exactly.
Great. That's really loads of really interesting topics that I feel like we've covered. Is there any kind of final message that you want to say to clinical educators or for students?
I think for for educators, I think the overall message should be, if you say you're about something, what we need to do is now is to show you're about it, because talking is one thing, but acting is a whole different thing. People are judged on their actions basically. So are you I think in one of my podcasts that I did, I asked the question, which camp do you fall into? Do you fall into the I'm actively doing something, I'm changing my narrative, I'm working hard, as you've done this now? This is a very, I think this is a very good type of thing, so people can listen to this type of thing and understand. Obviously it's one perspective, it's my perspective, but other people have different things. It's not a monolith of me being the voice of everything, but is talking to different people, is to say, are you in the camp of you're doing something, are you in the camp of, and it's not really my problem, it's I'm not against it, but really and truly I'll leave it to them to do it, I'll leave it to someone else. Or in the camp of, I don't really see anything, I don't see a problem with it, I don't see anything. If you fall into that last camp, that's a very big problem. If you feel like there's really nothing wrong with the physiotherapy or healthcare in general, or the diversity levels of it. But the other camp of, I support them, but I'll leave them to do it, that's also not very productive. That's not helpful at all to anything. So it's asking yourself these questions, because I think as students we are often asked to reflect a lot, and reflect a lot. Do right reflections. Is, are you reflecting yourself? Find the templates where you can reflect and ask yourself, what more can you do? That's the best question. What more can you do constantly?
Great. Yeah, I think that's a really nice final message. What more can we do? And I think I just thank you for kind of, like you say, it's one perspective, but that's what we're trying to do here, is gather lots of different people's perspectives, particularly from voices that are sometimes not heard as much in the profession. So
Exactly. It's not a problem, Alice. I'm very happy you're happy you're doing this, and you know, as I always say, I'm more than happy, and there are a lot of people, well, my peers and people who are more than happy to talk about things like this and give more insights, because I think sometimes people feel like, well, they don't know how to approach it, but someone may look at this and just listen to, even if you listen to the first 5 minutes, but you're gonna gain something, and you're gonna be able to say, so that's the thinking process. That's what's going on in that black person's head. Even if you don't have the opportunity to just talk to me straight ahead, you can listen to things like this in different ways. Because really and truly, the age of the internet, you really don't have an excuse to not know something. You can know anything. I can know what's happening in North Korea, right? I can know what happened in South Korea, but you can learn almost anything from the internet. So it's just educating yourself one way or the other and changing the narratives.
great.